Good afternoon, everyone. I am going to present a rare case of bilateral posterior lenticonus. There is no financial interest. A 22-year-old male patient came to the IOPD with the diminution of vision both eye since childhood, but more worsened since 9 months. Patient was apparently less symptomatic 9 months ago. Then he developed slow progressive diminution of vision not associated with other symptoms. No any medical or surgical treatment history was there, and family history was also not relevant. On general examination, patient was well oriented with person, place and time, and rest other general examination and systemic examination was within normal limit. On ocular examination, unaided visual acuity was 6/60 and 6/36 in right and left eye respectively, and best corrected visual acuity was 6/24 in both eye. Eyelid and adductor, conjunctiva, cornea and the anterior chamber was within normal limit. There was an isocoria present, and lens having cataractus changes of NS2 grade, and posterior lenticonus was present in the both eye. Goldman applanation tonometry, intraocular pressure of the right eye was 12 mmHg and the left eye was 14 mmHg. On gonioscopic finding was normal, and the fundus finding was within normal limit in both eye. On direct ophthalmoscopy, oil droplet sign was present in both eye. On retinoscopy, scissoring reflex was present in both eye, and ultrasound biomicroscopy suggestive of vitreous changes. Here the picture showing bilateral posterior lenticonus and cataractus changes, and slit lamp examinations finding of the vitreous changes in both eye. On routine investigation, all the findings was within normal limit. My provisional diagnosis was bilateral posterior lenticonus with the cataractus changes. Patient was operated for the right eye cataract with the SICS with IOL implantation. His best corrected visual acuity after 1 month was 6/6 in right eye, and the left eye was planned for the operation. Differential diagnosis includes lentiglobus, Loeys syndrome and Alport syndrome. Posterior lenticonus is a rare progressive disease characterized by protrusion of the posterior lens capsule along with the lens cortex into the vitreous cavity, associated with local thinning or absence of the posterior lens capsule. More common than anterior lenticonus, but usually present unilaterally. Common cause of unilateral infantile cataract, but it is a very rare cause of bilateral cataract. Diagnosis is mainly clinical, but can be difficult in asymptomatic cases. It generally occurs sporadically, but familial cases have also been reported. In bilateral cases, X-linked and autosomal dominant inheritance have been reported. Prevalence is 1 to 4 cases for every 1 lakh children, and there is no sex predilection. Pathogenesis of posterior lenticonus is not very elusive, but various hypotheses have been postulated, like rupture of the posterior lens capsule resulting from highlight artery traction or trauma, congenital weakness of posterior capsule, aberrant hyperplasia of the subcapsular epithelium, disturbances in the tunica vascular lentis, and the vitritis or overgrowth of the posterior lens fibers. My conclusion is the present case may be a case of congenital bilateral lenticonus with the later development of the cataract in both eye with positive et al. Sign. Such case should be diagnosed as early as possible to prevent amblyopia and systemic complications. Treatment depends upon the age of the presentation, complaint, disease progression, and the systemic association. Thank you.
Thank you. Thank you so much.
What precautions did you take when you did the surgery? Because posterior lenticonus, always you'll have a PC dehiscence.
Yes,
so
ma'am.
any particular steps did you do different than what we do for pediatric eyes, which usually have this?
Mainly during the hydrodissection processes, there may be chances of the PC rent. So we take precaution during the hydrodissection. We didn't have hydrodissection. We proceed through the hydrodelineation process.
So you're saying it's a 22-year-old.
Yeah,
so it must be there also long behind in the childhood. So what hydrodissection? Yes, you have not done. It's okay. But any other thing? Did your procedure change in any other way?
Ma'am, to rule out ma'am amblyopia, is there any amblyopia? Maybe present, but there was not amblyopia in the patient.
Any special for IOL power calculation?
What, ma'am? Sorry.
Any special precaution for IOL power calculation?
Hello, we have got sufficient time, so discussion can be there. No hurry.